How have we learned to treat brain metastases over time? Imagine a time when a diagnosis of brain metastases was almost a death sentence, with only limited options and very little hope for longer survival. Over the past few decades, our understanding and treatment of these secondary brain tumors have changed dramatically, thanks to advances in medicine and technology. Today, treatment involves a combination of approaches tailored to each patient's specific situation, aiming not just to extend life but also to preserve brain function and quality of life. Back in the 1970s and 1980s, the mainstay of treatment was whole brain radiation therapy. This approach used high-energy rays to target the entire brain, helping control multiple tumors and relieving symptoms. While it did improve survival from just a few weeks to about 4 to 6 months, it often caused side effects like memory problems and cognitive decline, especially as patients lived longer thanks to better systemic cancer treatments. In the 1990s, surgeons began to play a bigger role. For patients with a single accessible brain metastasis and good overall health, surgery could remove the tumor directly. When surgery was followed by radiation, it often led to better survival and neurological outcomes compared to radiation alone. But surgery was only an option for patients with limited disease and good health, since it requires a safe and accessible tumor. The biggest leap came with the development of stereotactic radiosurgery. This technique delivers highly focused radiation beams directly to the tumor, sparing the surrounding healthy brain tissue. It became a game changer because it reduced side effects and preserved cognitive function. Since the early 2000s, clinical studies showed that stereotactic radiosurgery alone or combined with other treatments was effective for patients with a small number of brain metastases, usually 1 to 3. It also offered an option for those who couldn't undergo surgery. More recently, understanding the molecular makeup of cancers has opened new doors. Targeted therapies and immunotherapies have been developed that can sometimes cross the blood-brain barrier, the protective shield around the brain. Drugs like tyrosine kinase inhibitors and immune checkpoint inhibitors have shown promise in controlling brain metastases from cancers such as lung cancer and certain types of breast cancer. For example, drugs targeting the HER2 protein in breast cancer have improved outcomes for patients with brain metastases from HER2-positive tumors. Combining these systemic therapies with radiation is an active area of research, aiming to improve both survival and quality of life. Throughout all these advances, supportive care remains vital. Medications like corticosteroids help reduce brain swelling and manage symptoms, improving comfort and function. The overall approach has shifted from simply trying to palliate symptoms to a more personalized, multidisciplinary strategy that considers the patient's overall health, tumor characteristics, and preferences. In summary, the way we treat brain metastases has evolved from mostly palliative radiation to a sophisticated mix of surgery, focused radiation, systemic targeted and immune therapies, and supportive care. This progress reflects ongoing research, technological innovations, and a better understanding of cancer biology. It's important for patients to work closely with their healthcare team to develop a treatment plan suited to their individual needs. As science advances, we hope to see even more effective and less invasive options in the future, offering hope and improved quality of life for those facing this challenging diagnosis.